Have you guys heard of diastasis recti, also known as ab separation? A lot of female women who have been pregnant have struggled with diastasis recti and the abdominal separation. Now, did you also know that men can struggle with this same thing? Men have been known, some men have been known to have the same problem of the abdominal wall separation down the midline of their stomach. Now, this happens because a lot of men who are overweight or their stomachs get, too big in this area, it causes that abdominal wall to be weakened and stretched. And it actually separates over time from being too big or too overweight or going on for a really long period of time. And we started noticing this after we'd have a male client lose, 40 to 50 pounds around that area. We started noticing that they'd have this line down the midline of their stomach here. And that could be diastasis recti. And that's actually when that bulge comes down the midline of the stomach there, that's actually your intestines and organs that could be trying to push through the weakness there, okay? And that's where that bulge comes from. So we're gonna show you a couple of exercises that you can do to try to improve this and help with diastasis recti with the ab separation to strengthen these core muscles back together. Stay tuned. All right, so first, let's see if you even have diastasis recti to begin with. Here's a little example of how you can check yourself to see if you're struggling with that. Always go to a doctor, get evaluated before doing any exercises or anything like that. But this is one way you can check. So you want to lay down flat on your back here. And what you're going to do is brace the core, and you're going to come up into the sit-up position here. And you're going to want to get one finger or two fingers here, and you're going to place it down the midline of your abdomen here, okay? And you're going to see and check to see if you have any separation down the midline of the abs. And if you do, if you can fit, a finger in between there or two fingers in between there, that's identifying that you do have a little bit of separation going down the midline of your stomach there. Here's what you can do to fix it. All right, guys, so I'm going to show you two exercises here that can really help improve diastasis recti. The first one we're going to go over here is the stomach vacuum, okay? This can hit your transverse abdominals, deep core muscles inside you. Now, the thing is, most people do stomach vacuums wrong, okay? They just go to suck their stomach in. They don't focus on the breathing and the flexing of the transverse abdominals at the same time. Now, when you start with the stomach vacuum, you have to start laying down on the ground. It's really hard at the beginning stages. This is the best way right here. And then when you get stronger, eventually you can do it while you're standing up. So what we're gonna do is suck our belly button in towards our spine, and we're gonna focus on short breaths, and we're gonna flex the transverse abdominals deep within us, okay? So you're gonna suck in and flex, keep that core tight, focus on the breathing, okay? Short little breaths. You wanna do that for about 15 to 30 seconds, then stop and take a break, breathe, and then we'll do it again. You'll wanna do 2 to 3 sets of this, and it's gonna have to be done for a period of time for it to help be corrected. All right, so here's another exercise that you can do to help improve diastasis recti, okay? And that's the ab separation down the midline of the wall of the abdomen. So what we're gonna do is some dead bugs. Now, we're gonna show you a technique here of how to do the dead bugs effectively so you can improve the diastasis recti. Now, I'm gonna have Ashley get up in the dead bug position here. She's gonna have both her knees up and her feet in this position. Her hands are gonna be pointed straight up towards the ceiling here. Now, what she's gonna wanna really focus on here is keeping this abdominis sucked in, and she's gonna wanna brace at the same time, okay? So she's gonna wanna keep it tight, but she's gonna wanna draw the belly button in towards the spine. Now, we don't want to round and bulge the stomach when you're in doing this, because we already have trouble with the stomach being bulged out for a long time, and that's what caused the ab separation. So we need to train it to come back in where we can tighten the midline of the abdominis and bring this back together. Okay, so Ashley's gonna go opposite arm, opposite leg. She's gonna focus on her breathing, bracing that core, drawing that belly button in towards the spine. During this process, you wanna make sure that your low back is flat against the ground, okay? Do not let that low back arch. When that leg goes down, that low back is going to want to arch. Now, if this is too advanced for you, you might want to just start off with some simple marching to begin with and focus on sucking the belly button in towards the spine and keeping the low back flat against the ground. All right, guys, so we just went over 2 exercises that can help with diastasis recti. Remember, that's the separation on the abdominal wall here, right in the middle, and it's where the stomach usually gets too big and you get that separation. You don't have to be a pregnant female to get this. We have seen this show up in males, and it's usually from being overweight, and men carry most of their weight right here in their abdomen, in their stomach. They get these big, hard, round stomachs, and it causes that separation. So what you'd want to do is train them abdominal muscles to get strengthened and come back together. If you have any questions on how we can support you further, don't hesitate to reach out. Remember, you can use these exercises at your own free will. And also remember to go to your healthcare provider and get checked out before you start any type of exercise routine, just to make sure everything's okay. If you guys need some more support, I'll be here to support you. Again, this is Aaron here with Iron Therapy Training, and we look forward to seeing you soon.